Welcome to the STEMS Health Miami Stem Cell Therapy Podcast. STEMS Health is a regenerative medicine clinic in Miami Beach, specializing in advanced non-surgical treatments that help the body repair and restore itself. Visit stemshealthregenerativemedicine.com for more info or to book an appointment. From stem cell and PRP therapies to peptides, IV treatments, and hormone optimization, our focus is on helping you feel, move, and perform at your best. This synthetic podcast brings you clear, physician-guided insights into how these treatments work, what to expect, and how regenerative care is transforming modern medicine. Now, here is today's topic. A guide to Muse cells and Muse cell therapy. Muse cells, short for multilineage-differentiating stress-enduring cells, have emerged as one of the most promising breakthroughs in regenerative medicine. Discovered in 2007 by researchers at Tohoku University in Japan, these remarkable cells have since become the focus of extensive research and clinical trials around the world. They're not just another kind of stem cell. Muse cells are uniquely equipped to repair tissue, regenerate organs, and even restore function in conditions once considered irreversible. Today, we're exploring what makes Muse cells special, how they work, and what patients should know before considering Muse cell therapy. What are Muse cells? Muse cells are naturally occurring, pluripotent stem cells, meaning they can develop into almost any type of cell in the body. But unlike other pluripotent cells, they exist quietly within our own tissues until they're needed. You can find them in the bone marrow, blood, and connective tissues of nearly every organ. Under normal conditions, they remain dormant. When the body experiences injury or stress, they wake up, migrate to the damaged area, and begin the healing process. Muse cells express a unique set of pluripotency markers, OCT34, NANOG, and SOX2, and possess extraordinary resilience. Unlike embryonic stem cells or induced pluripotent stem cells, they are non-tumorigenic, meaning they don't form tumors when transplanted. This makes them inherently safer for therapeutic use. In essence, Muse cells are the body's natural emergency repair system, ready to respond when tissues are damaged and capable of transforming into exactly the type of cells that are needed. How Muse cells work. The science behind Muse cell therapy is both elegant and powerful. When introduced into the body, Muse cells recognize chemical signals released by injured or inflamed tissue. These signals act like a biological GPS, guiding the cells directly to the area of damage, a process known as homing. Once they arrive, Muse cells can differentiate into the cell types that the body needs most. This may include endodermal cells, such as liver and pancreatic cells, mesodermal cells, including bone, muscle, and blood cells, ectodermal cells, such as neurons and skin cells. This remarkable ability allows Muse cells to repair multiple tissue layers at once, restoring structure, function, and balance. But their work doesn't stop there. Muse cells also release healing molecules, growth factors, cytokines, and signaling compounds that help calm inflammation, protect existing cells, and enhance the overall recovery process. This secondary benefit is known as the paracrine effect, and it plays a major role in reducing pain, improving circulation, and promoting long-term tissue health. Clinical benefits and therapeutic value. Muse cell therapy has shown potential across a wide range of medical conditions, particularly in areas where traditional treatments fall short, like neurological and cardiovascular diseases. Let's look at how Muse cells are being applied in each. One of the most exciting frontiers for Muse therapy is the brain and nervous system. Muse cells can cross the blood-brain barrier, something very few therapies can do, and transform into neurons, glial cells, and other specialized tissues of the central nervous system. In conditions such as stroke, spinal cord injury, and ALS, Muse cells have demonstrated the ability to integrate into damaged neural tissue, replace lost or dysfunctional neurons, and promote new neural connections. Early studies have shown improvements in motor function, coordination, and overall neurological recovery, outcomes that were once thought to be impossible. Cardiovascular conditions. Muse cells have also shown exceptional promise in the field of cardiology. After a heart attack, Large areas of heart muscle can become scarred and lose their ability to contract. Muse cells can differentiate into cardiomyocytes, or heart muscle cells, as well as endothelial cells and smooth muscle cells, helping restore heart function. Their anti-inflammatory and anti-fibrotic properties also help limit secondary damage, reducing scarring and improving long-term cardiac performance. Another key advantage is that Muse cells are immune privileged. That means they can often be transplanted between individuals without strict genetic matching or heavy immunosuppressive therapy. This simplifies treatment and reduces the risks associated with donor-based procedures. Clinical research has steadily confirmed what scientists have long suspected. Muse cells are both safe and effective in humans. Here are a few notable studies. A study published in the Journal of Investigative Dermatology showed that Muse cells helped heal chronic skin ulcers in patients with epidermolysis bullosa, a rare genetic condition. A phase 2 clinical trial in ALS patients demonstrated that a Muse-based product known as CL-2020 could slow disease progression and improve motor function. In another placebo-controlled trial for stroke patients, Muse cells selectively targeted damaged brain tissue and contributed to measurable neurological recovery. And in Japan, a first-in-human trial found that Muse cell injections significantly improved heart function in patients who had experienced a severe heart attack. Together, these studies point to a therapy that is not only effective, but also repeatable, scalable, and safe across multiple conditions. If you're exploring Muse cell therapy, here are several key factors to keep in mind. Medical eligibility and assessment. The first step is a comprehensive medical evaluation. Your healthcare provider will assess your condition, disease stage, and overall health to determine if Muse therapy is appropriate. Early intervention tends to produce the best outcomes, but every patient is different. Your age, immune function, and prior treatments will all influence whether you're an ideal candidate. Safety profile and risk assessment. Muse cell therapy has shown an excellent safety record in clinical trials. Because these cells are non-tumorigenic and immune privileged, the risks of rejection or cancer are extremely low. Most patients experience only mild temporary side effects, such as soreness at the injection site. Still, ongoing monitoring during and after treatment is essential to ensure the best results and identify any individual reactions early. Treatment, logistics, and planning. Muse therapy typically involves multiple treatment sessions spaced over time. Each session takes place in a specialized clinical environment equipped for regenerative procedures. Coordination with your existing medical team is crucial to avoid conflicts with other treatments. Post-treatment follow-ups and imaging may be required to track progress and adjust your care plan. Provider selection and quality assurance. Choosing the right provider is one of the most important decisions you'll make. Look for clinics with certified physicians experienced in Muse cell therapy and a track record of transparent, ethical practice. A consultation can help you gauge their expertise and ensure they align with your health goals. Don't hesitate to ask about credentials, protocols, and patient outcomes before beginning treatment. Setting realistic expectations. Every patient's journey is unique. Results may take weeks or months to appear, and progress often occurs gradually rather than overnight. Muse cell therapy can slow or stabilize degenerative processes, but it may not completely reverse long-term damage. For many patients, it offers meaningful improvement in function, mobility, and quality of life. But maintaining realistic expectations is key to a positive outcome. Reach your health goals with personalized Muse cell therapy at STEMS Health. Muse cell therapy represents a powerful step forward in regenerative medicine, a safe, natural, and scientifically validated option for patients seeking alternatives to surgery or conventional drug therapies. At STEMS Health in Miami Beach, our physicians specialize in personalized regenerative care, using Muse cell therapy to help patients with chronic pain, neurological injury, and degenerative disease restore their health and performance. As clinical research continues to expand, Muse therapy is expected to become one of the foundational tools in 21st century medicine, uniting safety, precision, and biological intelligence in one remarkable treatment. If you're ready to explore your options, schedule a free consultation with the Muse therapy team at STEMS Health. Discover how the body's own healing cells can help you recover, rebuild, and renew naturally. That's all for this episode. Thank you for listening to the STEMS Health Miami Stem Cell Therapy podcast. This podcast is for informational and educational purposes only and does not constitute medical advice. Listeners should consult a licensed healthcare provider for individual diagnosis or treatment. Some therapies discussed may be considered investigational or are not approved by the FDA. Results and outcomes vary for each person, and no guarantees of benefit are implied. All participation in such treatments is voluntary. To learn more about regenerative and restorative treatments, visit stemshealthregenerativemedicine.com or schedule a consultation at our Miami Beach clinic. Stay tuned for the next episode of the Miami Stem Cell Therapy podcast and have a great day.